gotta for me. No do, say that, oh. No do, shakara, oh. No do.
Hola muchachos y muchachas. Today I'm gonna be discussing how to talk to doctors, because honestly, man, doctors be tripping me out. It's crazy. It doesn't matter if you're a new grad, experienced nurse, whatever the case may be, talking to doctors is always a tricky situation. So here's some tips that I use, that has gotten me through speaking with doctors, because a few months ago I was like, the doctor's calling, here, I can't do this. I get panicked because I don't know what they're gonna ask me, but through the couple of months, I've learned a couple things, and so I'm going to share with you guys. The first thing is you need to know the doctor. Now, for me, I work nights, so it's a little bit difficult to put a name with a face, because I know their names, I know their specialty, but because I don't see them, I don't know them, and they don't know me. There's only one doctor who knows me. That's because we're Nigerian. That's it. But yes, you need to know whether the doctor's demeanor is usually nasty or nice, whether you can dab them up, or you just look down and walk and mind your business. So knowing that helps you approach them in a better way. Second thing is you need to be prepared. I've said this in every other video, like literally everything in nursing is you need to be prepared. Before you call the doctor, you want to make sure you have the latest vitals. You want to make sure that if you need to, you can write it down. When I first started working as a new grad, I wrote it down exactly what I was going to say, like a script. And I was like, hello, I'm calling from room, and I would just go ham and finish everything and then breathe, because that was just the simplest way to do it. If the patient is in pain, you want to know where the pain is, what type of pain it is on a scale of 1 to 10. Have they experienced this pain before? Is it constant? Is it intermittent? Is it throbbing? Is it stabbing? You want to get your details so you're not running back and forth and be like, hold on, let me ask. Hey, is your pain? Hold on, let me ask. Hey, no. You want to be well put together. And another thing, when you're on the phone, you want to make sure that you have thought ahead. Well, this is going to apply to night nurses and to day nurses too, but I work nights, so whenever I call a doctor, I just want to make sure that I get everything I need for that night. So if the patient has sleeping pills they need to take, anxiety pills they need to take, I'm calling them before it hits 10. Because they're more approachable. Now once it hits 11, 12, they'll be a little bit grumpy, but it has to be done. So once you've gotten all your material ready, you've gotten your script ready, you want to make sure that when you call the doctor, you state what hospital, because doctors work in different facilities, so you can't expect them to be like, oh yeah, that one patient out of my bazillion patients. Just like we have 6 patients, they have a huge amount of patients as well. So when you call them, you state your hospital. You want to state the room number and the patient's name, and give a little detail. Be like, so this is what it'll kind of sound like when I'm on the phone with a doctor. Hey, doctor, so-and-so, I'm calling from the best hospital in the world. I have patient in room 123, Mr. Johnson. He just came back from his gastric sleeve, and he's complaining of 10 out of 10 pain. The pain, he says, it radiates from the midline incision to the right, and it is stabbing, shooting pain. Can I please get some pain medication? Or what orders would you like for me to obtain? Get the orders down, and you always make sure you read the orders back. Make sure you read them orders back. So in case you catch any slippage, So, oh, you want Toradol, 30 milligrams, Q6, PRN for pain? Gotcha. Repeat it back verbatim and write it down. Make sure you have all your information, all your ducks in a row, and that you are prepared. Sometimes doctors will be like, oh, what do you recommend? We're not playing that game. I throw it back at them. I'm like, I'm not sure. What do you have in mind? Because I don't know drugs all too well. Like, I don't know. That's not my forte. I just started this journey being a nurse, so that's up to them. Okay, and speaking to doctors works the same way as speaking to the consults. So other doctors who are not primary, but they're like, okay, an endocrinologist, into the cardiologist, so you want to give them a background to the patient, because if that patient is a new consult, they're not going to know the patient. So you give them a little history. Okay, so Mr. Jones came in, and he just had the sleeve put in yesterday in the evening, and so now he's complaining of chest pain, radiating to the shoulder. Or what do you have you do? What do you have me do? And they probably give you some troponins, steady EKG, this, that, and the other, and you write the orders down, and then you put in the orders. And then I like to put notes spoke to the doctor, new orders received with Reebok, boom, bam, we're done. Okay, you know, initially I was a little bit scared to be calling the doctors at 3 in the morning, 4 in the morning, requesting orders, but that's the job of the doctor. That's what they're paid to do. So don't be scared, don't be frightened. Just have all you need to say together, you know, and it'll be okay. Have any other tips, you know, ways that you talk to doctors, ways that you found have been helpful, let me know. I'll let you go. Share your tips, your secrets, all that stuff. And as always, I will see you next time. Bye.